of April is National Minority Health Month. It is designed to raise awareness to improving the health of minority communities and to reduce health disparities.
According to the CDC, African Americans have higher health risk factors for stroke, high blood pressure, and diabetes compared to other groups. WKYT's Garrett Weimer and photojournalist Darnell Crenshaw talked to an African American medical provider who says getting more African Americans to go to the doctor could lower those risks.
We are particularly reaching out to our African American communities, making sure that they have access to the care that they need and how we can help connect them with that.
Kevin Hall, the spokesperson for the Lexington-Fayette County Health Department, says during Minority Health Month, it's all about meeting people where they are, meaning sending health department workers out into the community and breaking down language barriers and issues of mistrust between health officials and minorities.
There are long-standing reasons why minority populations are distrustful of vaccines and vaccination efforts.
Charlotte Thompson is a nurse practitioner. She sees patients from her home office via telehealth, focusing on mind, body, and spiritual care. Thompson is very aware of the generational illnesses that plague African Americans.
We are at the top of the list of that have the worst, suffer the most with high blood pressure, with diabetes, with so many of these common conditions. And mainly it's because we don't go get our yearly checkups.
Thompson says prevention is all about education.
We need teaching. That's what we need. And that's what I plan to do.
One of Thompson's patients is Ashley Campbell. Campbell says some African Americans have a fear of going to the doctor.
We're more afraid to go to the doctor. We're afraid of what they may say, what we may hear. So it kind of keeps us from going altogether.
The benefit of getting a checkup, the earlier something's detected, the better. Right now, Thompson is treating Campbell for bipolar, mood swings, and severe depression. Campbell credits Thompson with getting her on the right mental track.
Going from being afraid to leave my home to being outside now, feeling like I can live life, I can breathe. I see the benefits.
In the near future, Thompson wants to open up her own healthcare facility so she can help her community face to face. In Lexington, Garrett Weimer, WKYT.
And on April 29th, the Lexington-Fayette County Health Department will host a diabetes educational expo. That will be from 10 to 1 on that day on Harry Sykes Way, and that event is free to all.